This segment is sponsored by VCU Health.
The doctor is in and you have questions. COVID-19 is now one of the leading causes of death in the United States. Today, we're talking with Dr. David Lanning, the Interim Chief Medical Officer at VCU Health, to discuss battling the current surge and the rollout of the COVID-19 vaccine. Welcome, Dr. Lanning. It's nice to see you.
Good morning, Jessica.
Appreciate you making time for us. We want to start with a pretty important question. COVID-19 cases are on the rise. What do you think our community can continue doing to slow the spread of this disease?
That's a great question, Jessica. You're right. It is very concerning to see the surge of people in the community and patients in the hospital that have needed to be admitted with COVID-19 escalate. And in fact, it's even significantly higher than it was in the spring. We have probably 3 times the admissions that we had of COVID-19 patients in the spring. So it is definitely very concerning. And what we can do as a community is to continue what we know works. And that is with adhering to the guidelines of masking and social distancing, hand hygiene. And I think one point to make is that people have done a good job with that, other than one of the times that is where we sort of fall short is when people are sitting down together to have a meal or a break. We've seen that in the workplace, and of course, people are doing that in the community as well. And that's when, unfortunately, a lot of the transmissions are happening. So be very thoughtful about gatherings with people, whether it's functions or sitting down to a meal. That's a time when a lot of the transmissions are occurring.
Being thoughtful is key in so many aspects and so many scenarios. You're right, mask wearing, social distancing. A vaccine is not yet available to the general public. It is on the way. Thousands of healthcare workers in our area are already being vaccinated. Can you talk a little bit about how the process is going at VCU Health?
We've really mobilized a number of folks and taken the vaccine that's been provided to us and vaccinated almost, we've distributed almost 12,000 doses as of last night in about 3.5 weeks. We've already started our second dose with a number of those team members, and we've actually been able to vaccinate probably about 60% of our team members. So we've made great progress. We've now shifted to vaccinating medical students. We started that yesterday. And then today, we're even going to start vaccinating some of our patients in an outpatient setting, and hopefully in the next day or two, even some inpatients prior to them being discharged. So great progress. And we're also in close communication with folks at the VDH, VHHA, to start helping vaccinate community members, particularly those in that 1B group.
We have about a minute left, Doctor. I want to talk with you a little bit about folks listening to the advice, staying home, but they are curious, when will it be safe to venture out, to go back out again?
Hard to say. Hopefully, sometime in the next month or two, we'll start to see some signs that the numbers start to trail off a bit. However, again, even if you've been vaccinated, it's very important to adhere to those guidelines of masking and distancing. To make sure that people don't get infected at the last minute. One of the things too, I think is important to note is that people can receive care for chronic problems or urgent issues that arise. One of the things we noticed last spring was that some people delayed care and then ultimately their conditions worsened and became critical. So we do know that our emergency departments, our ER, all are very safe locations to come and receive care. Even to continue getting care with your primary care provider, some of which can be done via telemedicine, some needs to be done in person, but the measures are in place to do that safely. So I wouldn't hold off on that care, whether it's urgent or for chronic conditions if needed.
That's particularly important insight. We appreciate you sharing that. Thank you for making time for us. We really appreciate it.
Sure. Thanks, Jessica.
Absolutely. Great conversation. For more information about VCU Health, visit their website, vcuhealth.org.